Our suction is not working.
Don't panic, remember?
6 women waited 9 months for this day.
Get her out of me now.
Countless hours of frustration, worry, and hope.
We almost lost our first child.
What's the heart rate?
The first question to us was, do you want to terminate the pregnancy?
Wondering if today would bring sorrow.
They said the chances were very, very slim to make it.
The baby can have heart failure before birth or after birth.
Or overwhelming joy.
Oh, God! I love you.
Worrying if their babies will be delivered safe and sound.
How you doing?
Like I said before, the blood pressure cuff is going to go off every 15 minutes because that's how often I'm going to bump the Pitocin until we get you adequate, okay?
The last time Karen Brown had a baby, her heart failed. Now she is in labor at Mercy Medical Center in Baltimore with her second baby, at risk for a reoccurrence.
Remember, nothing to eat or drink now. We're starting the Pitocin.
The problem started in pregnancy with high blood pressure that was induced by the pregnancy.
Blood pressure cuff is going to go off every 15 minutes because that's how often.
The delivery went fine, actually, but 2 weeks after I had my son, I collapsed from coughing. I thought I had a chest cold. Turned out it was postpartum cardiomyopathy, which is basically just heart failure from the stress of high blood pressure and being pregnant. And
I'm going to increase the Pitocin by 2 milli-units every 15 minutes.
so that's why they're watching me like a hawk now.
The last blood pressure she had was 149/80. With her previous pregnancy, she was preeclamptic.
Preeclampsia is pregnancy-related high blood pressure. It can sometimes become serious.
And so we're keeping a close eye on her blood pressures to make sure they don't get any higher.
Well, I'm concerned that it could happen again because I know there's a chance that it can happen again. You're so sweet.
I'm a little nervous. I keep trying to tell myself not to worry and tell her the same thing. Try not to worry about it. To release some of the stress off yourself.
The only cure for preeclampsia is delivering the baby.
Karen's labor is progressing slowly. Prolonged stress on her body or the baby could lead to trouble.
How strong are they? Like on a scale of 1 to 10, 0 being no pain at all and 10 being the worst pain you've ever felt. How strong?
Right now they're about a 4 or 5.
4 or 5?
Yeah.
Okay.
I'm not trying to kill David yet.
I'm getting a little more nervous each contraction that comes along.
A few hours pass and Karen's labor intensifies.
How strong are they now?
Yeah, I'd say it's a 6 now.
6.
Steady, even 6. They're starting to hurt.
The pressure looks good. It's 132/84.
That's good, it went down.
Although Karen's blood pressure dropped, which is good, her potassium levels are also falling. This could put her life and the life of her child in danger.
With the potassium level is important because of your heart. The potassium works with the conduction of the heart. We want to make sure that it's going to work properly and not misfire or anything.
Okay, sounds like a good deal to me.
Can't wait till it's all over with. So I'm gonna take my baby home and go to bed.
Today they're doing fetal testing. I think they're going to check her heart rate and make sure that everything's going okay.
3 months ago, Amy Razor got devastating news that her 24-week-old fetus might not survive.
Hi, Amy. I'm Rachel. I'm going to be doing your test today, okay? Nice to meet you. Let's go to the back.
Amy is 38 weeks pregnant. She's come to Long Beach Memorial Hospital in Southern California for another ultrasound.
It was about 2 weeks after I'd had an ultrasound, which showed that everything was fine. Her heart was fine. She was functioning. And then we went in for just a routine checkup. The doctor went to do the Doppler, and she couldn't pick up her heart rate.
That would be her? Probably. There's a little bit of a slow heart rate, huh?
Usually around 60. After a few minutes, she realized she had her heart rate. It just didn't sound like a baby's heart rate. She was diagnosed with the heart block. So does this get her heart rate? Can it?
Yeah, it's absolutely picking it up, definitely. Your heart rate
It's
is...
where antibodies from my body went in and attacked it as if it was a virus. Where all the communication lines connect, there's swelling, which causes scarring, and all the communication within her heart is completely blocked. So the top chambers are beating separately or at a different rate from the bottom of her heart.
I just talked to Dr. Saul, who works with Dr. Najat, and she said, you know what, just do a BPP, which is an ultrasound.
Okay.
Okay? And that's what we're going to do for you.
Hi. Her heart rate ranged from 60 to 70, which is very low for a fetus. It should be between 120 and 140.
Do you know what you're having?
It's a girl. And we're pretty certain of that. We've had so many ultrasounds the last few months. The first few weeks, we were not coping well with it at all. It was very devastating to be told pretty much that you're going to lose a child.
There's the baby's eye. There's the hand.
And then their first question to us was, do you want to terminate the pregnancy? Which made us realize how serious the whole thing was. And it was very shocking.
Again, there's the abdomen, and you see the heart. And you can also see her still breathing. That's what we were waiting for.
She could go into heart failure and not make it. She can be just fine and function as a normal child. She could need a pacemaker. So basically they said if she did go into heart failure at any time before 36 weeks, her chances were very, very slim to make it.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10.
2 days ago, Melissa Stevens' water broke at her home in Virginia. She should have gone into labor immediately, but she didn't.
When that bag of water breaks, something happened. Do we know? No. We don't know what happened. We don't know what caused it. We don't know what makes you more likely than somebody else, but we know that the normal bacteria in your vagina now have the ability to go up into your uterus, which is not normal. So they can go up there and have a field day, multiply and cause infections, which could be an issue for the baby.
10.
Got one more? Just for good luck.
2,
Push him and keep him around that corner.
Doctors at the National Naval Medical Center in Bethesda induced Melissa this morning to avoid endangering her baby.
Okay? Right now, the baby's head, as it comes down, is not going up quite as quickly, which means you're stretching and giving room for that baby. This is sort of mother mad. One step forward, one step back.
You the boy or girl?
Surprise.
Okay.
I'm just gonna borrow this leg and turn it to your side a little bit, okay? And put the oxygen on.
Oh, yeah.
There you go. Yeah, just remember that old funny thing.
As a precaution, Melissa is on oxygen. Her contractions are intensifying, which could restrict blood flow to the placenta and make it hard for the baby to receive oxygen.
So we have bets on delivery time?
Doctors attach an internal monitor to the baby's head so they can assess the baby's heart rate more accurately.
I'm a little bit worried that you're going to tear upward toward the urethra clitoris. So can we make a little cut to direct the tear downward? Is it going to hurt? No, it's not going to hurt. But I don't want to. I hate this.
Yes, it's been going on way too long, huh?
Yes. You're almost
now
there.
It's a very frustrating
You're not going to be pregnant anymore in a half an hour.
To come back.
You're like minutes away here. You want to know if it's a boy or a girl.
In less than 20 minutes, Melissa will know if she'll have a son or a daughter.
Feeling all that pressure. Just breathe with it, baby. Just breathe.
It's just before 7 o'clock in the morning at Mercy Medical Center. Karen's labor has lasted throughout the night.
I have never been more glad to see you.
I never miss a delivery. I always get here.
Her blood pressure appears to be stable enough to withstand a normal delivery safely. Karen's heart isn't showing any signs of stress yet.
He needs to put on them things, because get her out of me now.
What happened is when I saw you in the office on Wednesday, everything was fine. Your blood pressure was perfect, and then you came here yesterday, and your blood pressure had gone up a little bit. And I don't want to wait.
Yeah, right.
That happened to you last time, and I don't want any kind of a repeat of what happened last time. So this is why
trust
we did
me,
this
neither
now.
do I.
And Everything seems to be in great working order. Your blood pressure's been controlled, and we're ready to have the baby. Oh, the head's right here.
Really?
Yeah.
Oh, okay.
When you have your next contraction, I want you to start pushing. Put your chin on your chest. Pretend like you're really constipated. Now, and push my fingers right here for the count of 10, keeping your breath held. Looks like you're having one now, okay? Can you hold her hand?
Yeah.
Can you hold her foot up for her? Deep breath in. And push. 6, 7.
Blow it out. Come on, right back at it.
That hurts!
Big deep breath in. Come on, Karen, focus and push.
Yes.
Do this. Good. She's right here. A little bit more.
7.
A little bit more. Wonderful.
Don't push.
I gotta push.
No.
I have to push. Oh, God! Oh!
Push. Come on, Karen, a little bit more. Oh, a little bit more.
Oh, God. Oh, I'm never doing this again.
If I had $1.
Ah, no, I mean it.
Be ready to deliver the rest of the baby.
Okay.
Just a moment.
Oh!
You ready?
Yeah.
Give me a little punch. The anterior shoulder is delivered. We have our girl.
Hey, happy birthday. I know.
That's like music to your ears, huh? You want to cut the cord? Here she is.
Oh, God!
Have the scissors.
Now let me take her and dry her up, okay?
I have good news for you. No tears. Which is wonderful. No tears, you need no repair.
Oh, great.
So we are all done. We have a patient who previously had a difficulty with her heart following a delivery. She's had no problem since. She's now delivered another baby with no problem with her heart at all. So this is exactly the outcome we were waiting for. I'm very pleased.
I am ecstatic. I am so happy. It is unbelievable. I really am. It don't get no better than this.
She's beautiful. Can't wait till she starts crawling.
Oh, yeah?
Yeah.
Then the fun begins, right?
19 and a half inches, Karen.
Oh,
Cheers.
hello.
Welcome to planet Earth.
It's okay. It gets better, really, it does.
Yeah, for you.
Well, I was in bed rest for a little bit, but they check me every couple weeks and see how I'm doing, and so far it's been pretty good. So I'm ready to have this baby. So.
At the Mother and Child Hospital at Presbyterian St. Luke's Medical Center in Denver, Penny Catalano has been in labor since 6 a.m. For the past 25 weeks, she's been in danger of losing her baby.
Yeah, I'm nervous and excited at the same time. Again, this is my second pregnancy, and you kind of, know what's supposed to happen or whatever, but I hope it goes well.
Okay, dear, if you'll curve as much as you can towards me. No, not so much forward, that's it. Okay.
At 14 weeks, Penny's cervix was stitched shut to prevent her from going into premature labor. She and her husband, Joe, couldn't bear to relive the traumatic events of her first pregnancy.
We almost lost our first child at 22 weeks. I don't think it ever gets any less nerve-wracking for mom and dad, but it's been a little bit trying, and I think we're just ready to get this finished.
Her pregnancies have been a little bit complicated because her cervix has shortened prematurely in the pregnancy.
Hey, do you know you're going to have a little sister in just a few hours? There's no way Penny could have carried the pregnancy to term.
Do you think he has any idea?
She was on really strict bed rest for the remainder of the pregnancy, which was almost 4 months. So that was a little dicey.
So we're going to check her cervix and break her water bag here and speed things along. She's about 5 centimeters dilated. There goes that water bag. Making a little flood here. For somebody who's had a baby before, it can dilate up to 1 centimeter an hour. Fully dilated is 10 centimeters. So about 5 hours from now, she should be 10 centimeters dilated, but I have a feeling she's gonna go faster than that. Right?
I need to jump up and down and have this, labor along.
Somewhat nervous. First time excited. The tribe is counting on her to deliver our first child, so yes, it's exciting.
At Mercy Medical Center in Baltimore, Jean-Louis Mafima escorts his wife Saraphene to the OR. Without the C-section she's about to undergo, they could have lost their baby.
Saraphene, actually her due date is in 2 days. She has what we call fibroids, which are non-cancerous tumors of the uterus. They're quite large, almost the largest I've ever seen in any patient I've had.
Since the beginning, they knew the fibroid was there. It just kept growing, growing, and growing.
She actually has one of the fibroids that is the size of a grapefruit.
It's so big that it's blocking the way of the baby passage, so there's no other way but to have this extension.
This surgery will be difficult because the fibroids, they require a large blood supply. That's why they get so big.
Our suction is not working.
So as I make my incisions on the uterus may bleed a lot more than normal.
I'm pretty nervous, but I'm just praying everything goes well.
Dad, you sure you're okay? You need a little oxygen?
Oh, no, not at all. I could use a beer.
A beer? We can do that too.
Can we have a retractor, please? Medium? The fibroid is way down low. Yeah.
I bet she's starting to feel something.
Can I have baby Simpson forceps? They should be right there. We're just doing some downward pressure here on the top of the uterus to deliver the head. There's a cord wrapped around the neck. I'm going to unhook the cord. I don't do that.
A tangled cord can restrict the oxygen and blood supply to the brain, causing neurological damage or worse.
Here we go, Saraphene.
Okay.
All right. We have a girl.
I want a souvenir tape. This was quite amazing.
The baby's doing good.
It's just wonderful. It's just, I don't know what to say. It's just, I'm so happy. I am really, really happy.
I think we got a little lucky, actually. The fibroid did not interfere with where we had to make the incision on the uterus. Never hurts to have a little luck.
Exactly what I wanted. I told my wife, I want a girl. She's gonna be daddy's girl.
It's on the table. We may need this later.
I think it's too beautiful.
Beautiful?
I'm happy.
That is wonderful. God is great. God is just great.
I know, but look, it's hanging.
It's right there. Do you see the head?
Yeah.
Melissa Stevens has been in active labor for 2 hours and is now fully dilated.
Just give him more. Little push for the shoulders. It's not going to hurt. Just keep going with the pressure. Keep
6,
pushing.
7,
Doing so good.
8, 9, 10.
See, now when the baby's head comes out, we're going to have you stop pushing so that we can suction out the baby's nose and mouth, okay?
And again. Everything
there it is.
Breathe, head's out.
Okay,
breathe. Touch the head. Touch the
Oh,
head.
there's your baby's head. There's your baby.
It's a ball headed baby.
Baby. Oh, baby. Yeah. Finish coming out.
Any minute, any minute. There's your baby. Help your baby. Help your baby. Help your baby come out. What a cutie. Good girl.
All right. Don't drop it. What is it, a him or a her? Don't drop her.
It's a girl.
What's her name?
Hermione.
Hermione?
Hermione.
Hey, pretty girl.
You fooled me, little punk. I thought you were a boy. I love you.
As the baby is delivered, the internal monitor is still attached to her head.
Say hi, Mom.
Hi, baby.
There's still my silly thing on my head.
Look at how little you are.
two arteries
about
are
time you
thick wall.
came out.
Okay. What is two vessel cord dissociation?
I love you.
Sorry. It can be like renal.
Let's see how pretty you are. Say hello.
You're a pretty girl. It was a lot more fun going in than coming out.
Most people say that.
I don't know if you're gonna have any brothers or sisters, kid.
Amy Razor anxiously awaits the delivery date that is now just 7 days away. She's come to Long Beach Memorial Hospital for a fetal EKG,
Okay, I think we should drop the lights.
Thanks.
a procedure that will check her baby's heart rate, which has been dangerously low due to a block. Dr. Doroshow sees only a few such problems each year.
Understand the rhythm best. First thing, Amy, is I don't see any fluid surrounding the heart, which means it's still functioning well. It looks like the pump is strong. The ventricles aren't paying any attention, so the atria are going regularly at about 132. The ventricles are on their own at 66.
What will the effect be on her that it can't accelerate to what her body would normally want it to?
Well, it depends on whether she can eject enough blood with the rate that she can do or not. If we feel that she can't do it enough to meet her needs, then we'll have to help her with the pacemaker that we talked about. The baby can have heart failure before birth or after birth, or never. And never is actually the most common. And when she's in the newborn ICU, she's going to be on a continuous heart monitor with the little stickers, and we can watch her actual rhythm on the screen 24 hours a day.
Dr. Doroshow cannot prescribe the best treatment for Amy's baby until after she's outside the womb.
We're covering for everything. We'll have the pacemaker ready.
For now, preparedness is the key.
Sometimes what happens if you have a lot of backache, it's because the baby's back is to your back.
Yeah,
Your labor can be a little longer, and sometimes you have to push a little longer as well.
Today is my due date. This is my first child. It's gonna be a little boy.
At Long Beach Memorial Hospital, 26-year-old Marlene Cunningham has been struggling through 8 hours of labor. She's ready to give birth. The father of Marlene's baby died 2 months ago from natural causes. Today's delivery will be a moment of both joy and sorrow.
I think she's doing wonderful.
Marlene's sister Cindy will be her coach through labor and delivery.
Oh, you poor thing.
I have this urge to push, and I don't want to push though. They taught us to blow out the candle. Blow out the candle. And it works.
He's right here. Oh, let's see if he's got hair.
Where is Dr. Cody?
Where is that? This way. This way? Yeah. Okay, stay.
How you doing?
Grandpa. Grandpa. She's awesome.
You okay? You started to push?
No.
Okay.
I mean, he's coming.
She's really doing well. Bring these legs back. Okay. Push, remember?
Push down here like you're having a belly.
Push. Good. 1,
Good.
2,
10.
3, 4, 5, 6, 7, 8, 9, 10. Take a breath. Breath.
Breath.
How you doing? Are you excited? Are you scared? Be there, honey. Just wait. Okay. Ready? Give me another one. Push again. Okay, hold Marley. He's right there. He's right there.
Marley, no panicking. No panicking, remember?
Ready, Marley? Pull. Oh my God.
Go hard. Come on.
Marley, come on, he's there. Push hard. Push, push. He's just right there. Push, push, Marley, push.
He's coming. Come on, Marley.
Push, push, push. Oh my God. Oh my God, Marley. Is he out? He's coming.
That's part of the class.
Okay. There we go. Okay.
Okay, so you're gonna go ahead and cut the cord. It's
right
not
here.
painful.
If I get the scissors.
There we go. Excellent. Say good
Oh.
job. There we go. Let's take this away.
Oh, he's so cute. He is awesome.
I'm so happy. Look at even his hands. Even his hands aren't blue.
What's his name?
We don't know yet.
8-5.
Oh, boy.
There we go.
There's my boy.
Boy, there's Mommy's baby.
Saraphene's baby shared her mom's uterus with 2 tumors, nearly half her size. Barely 5 minutes after she's born, serious complications set in.
If the baby's glucose level is at a very low level, it's at a dangerously low level. You need to have a certain level of glucose in your body or sugar in your body for all of the organs to work, the brain area specifically. And this baby's level has fallen to a very, very low point. It can sometimes fall to really serious levels and cause some serious complications. There are 2 ways of fixing the glucose level. One, and the easiest way, and the nicest way to the baby, is by letting it feed and take in a sugar source. The other way is you can get an IV line in and then give glucose right into the vein.
Look at that face.
They eat really well when they have low sugar levels, though. They do much better in their eating department than sometimes if they're really hungry.
Not feeling good? You still nauseous?
Karen Brown is exhausted minutes after giving birth to a baby girl at Mercy Medical Center in Baltimore.
Her blood pressures initially were a little borderline high, but they've come back down to normal.
A nurse starts Karen's EKG.
It takes a few minutes to get y'all hot wired.
Karen, this is Dr. Appelfeld from cardiology. I asked him to come see you. How are you? I'm fine.
Dr. Appelfeld is looking for signs of cardiomyopathy, the heart failure that jeopardized Karen's first delivery.
And the delivery was vaginal delivery? The problem with postpartum cardiomyopathy, which it sounds like she had, and it sounds like was proven by biopsy, is that it is a risk. You can get a recurrence. She got through this pregnancy, and it sounds like the baby's fine without a recurrence.
I'm a little tired. That's to be expected, but otherwise I couldn't be happier. I really couldn't be happier. And I'm gonna cry.
Finally, Karen and David get a chance to enjoy their new baby daughter, Mallory.
Just overwhelmed with joy. When I went down to the nursery to hold her, I couldn't hold back. I just cried. She's so pretty, beautiful.
Three hours into her labor, Penny's not dilating fast enough.
Okay, 6 centimeters, and your cervix has a little, what we call stenotic, or just a little scarring from your cerclage.
3 weeks ago, Penny's doctor removed the stitch on her cervix. Penny could have gone into labor at any moment, but now scar tissue from the cerclage is preventing her cervix from properly dilating.
Good. Okay, just wait and see. Baby's tracing looks fine. Baby looks healthy, and Stacy's going to help you out with some more contractions. That's about it. Any questions?
Right now, about every 2 to 3 minutes, so we're getting there.
It's still kind of slow. I mean, at first, you kind of want to get it started and things like that, but I think this takes a little longer than you would.
They always kind of make it sound like it's going to go a little faster than it actually is. So maybe, yeah, the clock's ticking a little slow right now.
After 6 hours, Penny's labor still hasn't progressed. The baby risks contracting a serious infection the longer it stays in utero.
Oh, look at Ben in here so early. How did Ben get in so early?
Making it to delivery day is a big milestone for Amy and Ben. But until their baby is born, there's no way of knowing how bad the heart defect may be.
This can be a significant problem, obviously, if the baby has either some underlying structural abnormality of the heart or if the heart rate itself is in some ways inadequate to bring enough oxygen to the baby as it's growing as a fetus and now as a newborn.
She could come out and need a pacemaker right away, and that's why the cardiology department is right on staff. That's why we came to Long Beach Memorial Hospital. I guess she could go into heart failure within a couple days or whatever.
You're gonna sit on that side right there, Ben.
The latest here.
Originally, we just had named her Payton, and then we hadn't come up with a middle name, and we chose Hope. It just seemed appropriate after what was happening, and so we were just very hopeful that she'd be okay and seemed to fit.
So are you nervous? Are you ready?
I'm done being nervous. It's been a while.
Can I have a pickup of Chief, please? I think she has a good surgical. The reason we did a cesarean section was because she's had 2 previous cesarean sections. Have another lap, please. We felt that our ability to monitor this baby in labor would be difficult. We could do it, but it would have been difficult because of the slow heart rate. Can I take a scissors now? We're in. Yep. Let's just see if I can go down a little bit more here. She's just a little rotated towards me, so midline view right there. Can I just have the knife, please, and suction up? Nice clear fluid. Okay, take this out.
Here comes the baby.
Wow, what are you doing?
Has a nice little face here. Hello, sweetheart. Okay, good one. Pressure.
There we go. Hi, pumpkin.
Hello, sweetheart. How many sections?
14, 17.
Hello there. I can't pull it out. Unbelievable. What's the heart rate?
What's the heart rate?
Hello?
Doctor wants to know.
Oh, it's in the 70s.
Yeah, that's what it's been. But she's screaming her head off. She looks beautiful, though. She really does.
Hi.
It's your mommy. It's your mommy. Say hi, Mama. There she is.
Congratulations. See you later.
From here, a team of pediatric cardiologists at nearby Miller Children's Hospital will take over baby Payton's care. She may need a pacemaker, or worse, open heart surgery. Barely 5 minutes old, baby Payton's heart is the focus of concern in the neonatal intensive care unit at Miller Children's Hospital in Long Beach.
Look how vigorous she is, how well she cries. If she didn't feel good, she wouldn't do that.
Amy's baby is getting a 12-lead EKG. Doctors need to examine her deformed heart as quickly as possible.
The heart is a three-dimensional structure, and we have to sort of create a three-dimensional image of that. So we put all of these stickers all over the chest in order to do that. They're just measuring the baby. I checked her heart, and it seems like her circulation is very good. She has good pulses, and her liver's not enlarged, and she's breathing well. Lungs sound good. Her heart is slow, as we expected. It's very regular. They're just trying to get a tracing of it right now. One of the things we have to do is make sure that she doesn't have any minor defects even in her heart. Got a very good look at it prenatally, but this is better. Her heart function looks really good. There's no accumulation of fluid around the heart, and she's very vigorous. So I don't think we're gonna have to put a pacemaker in her, and I think we're gonna watch her and see what happens. So I think we're in good shape here. And I hope we can get Mom in soon to see her because
Thank
it'll
you.
make
I
her
hope
really
so.
happy.
She got a little look at her, but I'm sure she'd love to come see her. She looks like Payton. Oh, honey, I'm so excited. That is so awesome.
Can't believe she's okay. Everything's fine.
All this time, all these worries. She's fine. She looks so awesome.
I'm so glad.
She's good color, no rashes. She's crying louder than she was in there.
Oh, good. She sounded
She
so
sound-
hoarse in there.
Yeah, she sounds better in there.
I'm so glad.
Then like 7 centimeter dilated, and just give me some more Pitocin, and just hopefully would speed up the labor.
The anticipation is just a killer.
7 hours after she arrived at Presbyterian St. Luke's Medical Center in Denver, Penny Catalano is still not ready to deliver her second baby.
Penny's progress was a lot slower than I anticipated. She's had a baby before. She started the day at about 5 centimeters dilated, but it took a lot of effort for that cervix to dilate past that stage, and I think that's due largely to the fact that her cervix was a little bit scarred from having 2 cerclages in the past, or stitches in the cervix.
She's complete +2, so almost there.
At 4:45, Penny's 10-hour labor finally intensifies after she was given Pitocin to stimulate the contractions.
You're the most beautiful laboring woman I've ever seen.
Can you get a little sweat or something to wreck the makeup? Could you do something to look?
Do we need the spray mist bottle or something?
Okay. You get a leg. If you
I wanted to win her.
You can put your...
You guys got me all excited for nothing.
Yeah, really up the time. I mean, I know you're dressed up for the occasion, but take a deep breath.
Awesome.
There
Right
we
there.
go. Keep it up. 6, 7, 8, 9, 10. Breathe.
And there we go.
Oh my.
All right, heads out.
Hold on. You're doing good.
Beautiful, Penny. Do it again.
Go. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000.
Here comes your baby.
More. Big breath. There you go. Push, 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 push.
Yes,
5,
perfect.
6, 7.
Go for it, Penny. Here comes your baby.
So you're okay. You're done. You're done. Just enjoy. See his little... Look at him. He's
Penny's big.
She.
Look at him.
She.
Oh, she. It's a she. Congratulations. Wow, she is big. All right, Joe. So we're going to put you to work here.
Sure.
Hard. Beautiful.
There we go.
And here she comes.
Here's Olivia.
Congratulations.
Thank you.
Well done.
Get in there. Wipe her off. Hi, baby girl.
Oh, yes.
Are you kidding? It was all worth it.
Oh, she did fine. She did great. Everything was normal. Had a healthy baby. She did have some hairs on her cervix that I needed to repair, but that went pretty easily. So you guys make beautiful babies. I'll see you again next year.
Thank you so much.
Pleasure.
It's nice to have you.
Okay. My pleasure. All right.
It's good. Relief. It went well. So you're kind of nervous at first, but it was good. It's not as bad as I thought it would be.
Here, Mama.
Oh my. I'm a lefty, so you turn this way.
Oh, say hello to your baby girl.
Hello, sugar.
She looks like Dominic when she cries, and she's sucking on everything in sight. So I'd say she is ready to eat.
One day after delivery, Melissa Stevens and her new baby daughter are recovering from the roller coaster ride of childbirth.
I had a great experience, but somebody today asked if I would have another baby, and I said, ask me again in 4 years, because today's not the right day to ask. Right now, I basically feel like I got hit by a truck, but I can't believe that yesterday she was inside of me and today I'm holding her in my arms. I can't believe that I'm a mother and this is my daughter. I don't think it's gonna sink in for quite a few days, and the same goes for my husband. I think nothing like it in the whole wide world. I've never felt anything like this. It's crazy.
Okay, Mark. Here's some water and here's your strawberries.
Marlene Cunningham adjusts to her first few minutes of motherhood.
All right, I'm going with my nephew. Oh, yes.
Her 8.5-pound baby boy will grow up without ever knowing the father who passed away.
Look at him, look at your cousin. Pretty cool, huh? Okay, come on.
Marlene's family, however, has already begun to fill the void.
It's okay.
13 3/4 inches for the head.
That's my boy. Here, leave me alone a minute. Pretty cool, huh? You're an hour older. You're an hour older.
9 hours after giving birth, Marlene names her baby after his father.
This is Ethan Dallas Cunningham. And he kind of looks like him. Look at his old rhythm cheeks going. Kind of hurts a little bit. I'm glad he doesn't have teeth, boy. I better get used to this. It's just perfect.
Baby's not happy with the situation. She wants to eat. We don't like to stress a baby with food in their stomach if there's a problem brewing.
Baby Payton's been in the NICU for 3 hours, but in the last 15 minutes, her blood pressure dropped to dangerously low levels.
In a term baby, it's usually around 40, and hers is in the mid-30s. It can be from her heart block, but it could also just be related to her fluid status after delivery. Mary Jo, is this picking up the heart rate correctly? I mean, you can watch and see. When she screams, her ventricular rate doesn't really accelerate. We're going to give her some IV fluids, and if her blood pressure stabilizes in the normal range, then we'll probably start her feeding, maybe in the morning.
We were told there's a good possibility she'd go home with us, but after just a couple hours, that idea went away real fast. She just wasn't stable enough.
For the next 24 hours, doctors will closely monitor Payton's unstable condition.
It's hard to watch her cry and not be able to do anything about it.
It's now 3 days after Payton's birth. She's very agitated because doctors still haven't allowed her to feed.
We're concerned that if her blood pressure is low, that the circulation to her internal organs, especially her stomach and intestines, might be low. And if we give a baby food, we can have problems. It could mean an infection or a problem as a result of low circulation. With the kidneys, it could mean poor kidney function, and so on. All of the organs have to receive circulation from the heart, and the blood pressure is what achieves that.
Payton won't go home until she's strong enough to eat.
It's wonderful. So the baby's doing great, and you know, she's feeding and she's doing good. And yeah, the Dr. Fargo was in here earlier this morning and checked us out, and she said we can go home today.
24 hours after laboring for 10, Penny is eager to bring baby Olivia home to her father and big brother.
It's postpartum day 1, and she has the option of staying actually till tomorrow, but she's real anxious to get home to her family, so I discharged her this morning.
I'm doing great. I felt great. I never thought, like, oh man, I just had a baby last night, and she's happy and healthy. So we're just excited to go home and enjoy this baby.
Hello. How are you? Well, you have to like it when the patient's ready to go even before you come to see her.
She's 3 days old, and Saraphene's new daughter, Tiffany, is now healthy enough to leave Mercy Medical Center. The baby's hearty appetite returned her glucose to normal levels.
I think the C-section went extremely well. It was rather uncomplicated for what could have been a very complicated cesarean section. We tried to prepare for the worst. The worst didn't happen, so everybody's happy.
It feels good. Finally get out of here today. Don't you feel good, sweetheart? I know you want to go home too. The baby is missing the hospital already. I always wanted to have a baby. It took us a year and a half before I could conceive, but I'm happy.
Ending months of anguish, Saraphene and her husband Jean-Louis enter a new chapter of their lives as proud parents.
Yeah, this is great. Yeah, I just want to go home.
You have to lay still for me, okay?
You want me to take it?
Maybe you
Try to soothe her while you do it?
Yeah. Okay.
After 3 days in the NICU, Payton receives yet another sonogram. The good news is her blood pressure climbed to 41 from an unhealthy mid-30s a few days ago.
Well, everything's going positive the right way.
So now
we're turning off, right? Yeah.
Would you like that better? Oh, there's like too many tubes on you. Is she gonna wake the whole time?
Huh?
Was she awake the whole time? Did she not like the ultrasound?
She hated it. Every time the ultrasound tech touched her with that thing, she cried.
Was that no
So
Finally, Amy hears something positive.
She can have breast milk. Okay, so I'm thawing some of it.
Great. I just brought some more.
Okay, very good.
Hey there.
Yeah, her blood pressure's good. She's satting good. You know, her heart rate is still, low. Good. Her blood pressure mean is fine. We wanted to keep it above 40, and this one is 50, so she's staying good.
I didn't get to really touch her or hold her. And today I held her a few times. I fed her twice. It's been a lot of new stuff today. Today she's been very different, I think. I mean, I'm only with her for like an hour at a time, but the time I've been in here, she seems so much happier. Dr. Dorshow even said she'd like to send her home tomorrow, but they really need to watch her feedings, I think, for at least a day. And as long as she's eating well, by the end of tomorrow, I think Sunday will be the day.
For the time being, the Razors can set their fears aside, but Payton's heart will likely require long-term medical care.
I did give them, both Ben and Amy, the likelihood that sometime in Payton's life that she will need a pacemaker. It's unlikely that she'll get away without one. It's hard for me to imagine that she will never need one, but she might not need one for a long time.
For each of these 6 families, their fears have evaporated with the promise of new life.